This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning and welcome to another Ministry of Health virtual media conference which provides you with clear and accurate information on COVID-19. Today we have with us the Honorable Terence Dayal Singh, Minister of Health, Dr. Hazel Othello, Director of Mental Health at the Ministry of Health, and Dr. Carla Maria Alexander from the Faculty of Medical Sciences at the University of the West Indies St. Augustine campus. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. I invite the Minister of Health to make the opening presentation and give the clinical update.
Thank you very much, Candice. Good morning to Dr. Othello and Dr. Alexander. Good morning, ladies and gentlemen of the media, and to the wider listening and viewing public wherever you are. So today is, I believe, Wednesday, 10th of February. Got my days mixed up there. For a change, I normally give the global output. And for a change this morning, the news coming out from the global scene as far as COVID-19 is concerned is a lot better than it was when last I gave it. There are still 107,515,575 active cases. And yes, 2,353,910 people have in fact died. So those numbers are not good. But when one looks at the daily new cases, for the first time since maybe July last year, average daily cases are just above 250,000 around the world. It has dropped from a peak of 800,000 just a few weeks ago. And now we are down to about 270,000 cases around the world. That is very good news, very good, encouraging news. And more importantly, daily deaths have come down significantly. When they were peaking at around 16,000 a day, which I reported the last time I was here, they are now about 8,000 to 9,000 a day. So significant improvement in both daily new cases and daily deaths, but people are still dying by the thousands. So we have to look at both sides of the coin. The clinical update for today: total new positive cases, 1, which you would have received yesterday. Total number of persons tested at both public and private facilities, 88,736. Total positive cases for COVID-19 from the 12th of March 2020 to present, 7,617. You would notice that since around October last year, this rate has decreased substantially. Total number of patients in hospital stands at 27. Total number of recovered patients, 7,302. Total active positive cases at this time, we have gone down below 200. We are at 179. Total number of deaths, and our deepest condolences to all the families, 136. That has also declined and slowed considerably. Yesterday, unfortunately, we did have 1 death. Total number of patients in step-down facilities, 0. Total patients in state quarantine facilities, 273. Total number of persons in home self-isolation, 151. The 27 persons in hospital are distributed as follows. Cova Hospital and Multi-Training Facility, we have 17. 4 in ICU, none in HDU. At the Cora Hospital, we have 9. Arima, 0. Augustus Long, 0. St. Anne's, 0. Scarborough Regional Hospital, Fort King George, 1. Scarborough General Hospital, Signal Hill, none. COVID-19 positive patients in step-down or transition facilities, none. So Claxton Bay is empty, UWD Bay is empty, and Tobago is empty. So that's the clinical update for this morning. In the couple of minutes I have, I just want to bring to fore what the Ministry of Health's intention is as we move forward to a new phase in managing COVID-19. For the past 10 months or year roughly, we have been managing the disease. Managing the disease by closing borders, by physical barriers like masking, the social distancing, the washing your hands, asking people to stay home if you are ill, and all the other public health measures. Decreasing crowds, closing rivers and streams. At one time, most businesses were closed and so on. That is how you manage a disease in a pandemic. But managing a disease is different to what we now want to transition to. We now want to transition from managing the disease, which is like a battle of attrition. Today the virus wins, tomorrow I win. But so far we have been managing well. We now want to move from managing the disease to controlling the disease. When we talk about controlling the disease, we mean now that we have some, for want of a better term, some dominion over the COVID-19 virus. Some dominion. It means we could tell the virus what to do, where to go. I just say that figuratively. How do we do that? You can't do that with the public health measures, borders being closed. That is management. To control now, we have to move to the next phase, which talks about vaccinating people. That is how we could control this virus. And if we could control the virus with a robust vaccination program, which we have put in place, are putting in place, then life as we know it, or as we knew it before February 2020, life as we knew it a year ago, could return to some degree of normalcy. That is what we want. So, grandchildren can hug grandparents. So you can have a wedding. So you can have a birthday party. So the social interaction that we have been craving and missing for the past 10 months, we can start to have some of that again. And the last parts of the business community, like nightlife and so on, we can look favorably at reopening those things. But to do that, we must get a certain number of people vaccinated so we could control the virus. So I just want to repeat, what we are starting to do from February, March, and going forward is the vaccination drive to control the virus so that life could return to some degree of normalcy. You may still have to wear masks. You will still have to social distance. Wash your hands. But what I would like to see coming out of this, no more deaths. No more hospitalizations. No more people in intensive care units. You would like to see more and more children go out to school. So those are the wins that we want to have. The vaccines, according to PAHO, WHO, the timeline they have given us, again, is late February, which is just about 2 weeks ago, 2 weeks again, or 3 weeks again, into early March. We have made all preparations to start the vaccination drive. Once the vaccines are physically in Trinidad and Tobago and we can certify that the cold chain has been maintained, we anticipate the rollout to start between 3 to 5 working days after receipt of the vaccines in Trinidad and Tobago. So those are the type of timelines we are working with. So 3 to 5 working days, that will allow us a time to store, do all the paperwork, get it out to the RHAs, get it out to the sites, get it out to Tobago, so that we could have a coordinated national response in the first instance, where we start to vaccinate and give our healthcare workers, especially those on the front line, the first bite of that vaccination cherry, at least for the first week of the program. We are dedicating the first week of the program to only healthcare workers in the front line who have the highest risk of exposure. So those in the COVID hospitals, those in the accident and emergencies, the district health facilities, they are getting, because those are our most cherished and highly exposed population that we are concerned about. After that, we start to roll out to the NCD clinics, the essential workers, and so on. So that is where we are right now with the vaccine. I'm giving you a little more detail about what we are doing in the first week, dedicated to frontline healthcare workers. Once we are, and we have already asked the RHAs to supply us with those names, so we'll be reaching out to them, making the appointments. The RHAs will be responsible for vaccinating their frontline healthcare workers in the first instance. And then we move down to our NCD clinics, our essential workers, our elderly, and so on. So that is my global, local report and my little report on where we are with the vaccination drive. So Candice, thank you very much, and back over to you.
Thank you very much, Minister Dayal Singh, for that signal that we are going to be moving from management of COVID-19 to control. And next we go to Dr. Alexander from the Faculty of Medical Sciences at the University of the West Indies. And she will demystify or clear up some misconceptions about this very topical subject: vaccine development and approval, safety and efficacy.
Today I will be talking about vaccine development and approval with special emphasis on the COVID-19 vaccines. Next slide.
To fix the audio and start back.
So when we think about
Hi, so I think we have a little technical difficulty there with Dr. Alexander. Her presentation is very critical, so we want to make sure that you hear every drop of her presentation. And so I assume now that at this time, we will go to Dr. Othello while we clear up some of the issues with the presentation from Dr. Alexander. So we go to Dr. Othello. We know that some of our children return to school on Monday, and we go to Dr. Othello, who will give some coping tips for these children and some resources as well for their parents. So we go to Dr. Othello.
Good morning, Minister Dayal Singh, Dr. Alexander, Ms. Alcantara, viewing and listening public, and of course members of the media. Thank you for listening this morning, and I will be happy to share, as Ms. Alcantara said, some tips to help both children and parents as they try to cope. And much has been said, over the past few months about the mental health impact of the COVID-19 pandemic, both globally and locally. And we've shared information with you from time to time about coping tips. But we want to reinforce this again, particularly as our children are beginning to return to school. Returning to school could be stressful under normal circumstances, and at this time it's very different for them. And it's the children who are returning first are the children who have exams coming up, which adds another layer to the potential stresses that can be facing them. So we want to make sure we talk to those young people and to their parents this morning. We've been providing tips, over the past few months since the onset of the pandemic, particularly about self-care. And we want to talk about that again in a little bit. While I am sure that many children are eager to go back out to school, for some it is not so easy. Some children are anxious, some children are fearful, some children have had to deal with difficult family events. They may have had deaths in their families since the onset of the pandemic. They may have lost loved ones. They may have not been seeing their friends for a long time and may have been a bit lonely. So a lot is going on in the minds of our children. And as they return to school, they have to balance the need to return in order to meet their curriculum needs with their anxieties and their fears. And that's why it's essential that we have this talk this morning. In addition, they are returning to a much different school environment. They're not going to be seeing all the teachers they're used to seeing at the same time. They're not going to be seeing all their friends at the same time, as smaller numbers of children are returned to the classrooms, in this phased approach. So, for instance, a child may be looking forward to hanging out with their best friends, and on returning to school may realize that that group of children are not in the group that's returning first. Or if there's a system at some point where children go on alternate days or things like that, those are adjustments that they have to deal with. In addition, they also have to deal with new rules. They're not allowed to hug each other, especially hugging the friends that they haven't seen for a long time. That can be difficult for them. They can't, have that affectionate touch, that handshake, that high five, the things they're used to doing. If you've ever looked at young people hanging out together, you know that is going to be a difficult adjustment for them. So that it's very, very important that parents talk to them about these things before they return to school, particularly the younger ones, so that they know what to expect, so that they're not suddenly upset when a teacher or other member of staff tells them they shouldn't be doing something, because they've been prepared for it from before they return to school. Remind them about the importance of frequent hand washing and things like that, so that they go out to school knowing what they need to be doing. Even though they may have difficulty remembering sometimes, when you tell them up front, then when somebody else reminds them, it's that much easier for them. What advice can I give to the parents? This actually is the same thing we've been saying over and over. Self-care, 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 and even to the children, self-care. That's the most important thing. We cannot overemphasize the importance of self-care. In other words, if you're preparing for an exam, yes, you have to study, and good study habits demand a lot of you, but you still need to eat well, you still need to sleep well, you still need to exercise, you still need some extracurricular activity within the framework of what's allowed during the pandemic, what you can do safely. So you still need to do those things because, in order to study effectively, your mind has to have periods of rest and relaxation. So it's very, very important that you take care of yourself. Parents, it's important that you take care of the younger ones. You keep an eye on what's going on with them. You listen to them. You look out for any changes in their activities. Are they looking as though they're sad more often than usual? Are they not talking as much as they usually would? Are they becoming irritable? You have to keep an eye out for those things. And if those things are happening, you need to get to the bottom of what's happening. And a good way to do that is even before you see anything like that, be talking to them, be reminding them that they can come to you with anything, especially as they return to school. Remind them that if anything is happening in school that they're not happy with or they're not comfortable with, they should feel comfortable talking to you about it so that you can help them. Remind them that it's okay to feel a little bit anxious sometimes. We all experience that, but it's good to talk about what you're feeling, talk about your emotions, so that we get it out there and so that we get explanations and we get coping tips. I like to use the analogy of, when we get on a plane, the flight attendant always tells us, during that security briefing, that we must put on our face mask first before we try to help somebody else with theirs. So I'm saying to the parents, in terms of your mental health and your emotional stability, put on your face mask first. Take care of yourself so that you're better able to take care of the children. Young people, remember that how we think about things determines how we respond to them. So even as we face all those challenges that I've mentioned, if we look at them, as I've said before, as obstacles to be overcome, as challenges rather than obstacles, in fact, challenges to be overcome, rather than obstacles that are going to get in the way of your happiness, or get in the way of your success. If we look at them as challenges and we are focused on solutions, we tend to approach things in a more healthy manner, in a more positive manner, and we are able to cope better. And if having done all of that, you're still having difficulty, remember to talk to someone. That's the most important thing, so that that person can assist you, or if what you need is beyond that person's ability to assist you, they will find someone who can and get you in contact with someone who can assist you. So now that I've shared the tips, I'm also anxious to share with you some resources where you can get that help if you need it. And in that regard, I'm pleased to announce that on January 12th of 2021, the Mental Health and Psychosocial Support Technical Working Group launched our directory of services, so that now we have a one-stop shop online where persons can access mental health and psychosocial support services. You simply have to go to the website, and I'll ask the technical crew to put it up on the screen for us now. It's www.findcareTT.com, and that takes you to an amalgamation of a large number of services. We've been working with a number of stakeholders who provide different types of services. So now you can go to that search line, that says search here, and you can type in what you're looking for. You type in the type of service you're looking for, and what will come up will be a list of the services that provide what you need. For instance, and particularly important to what we're talking about here today, one of the resources there is Childline. And Childline is an NGO-run helpline service that supports children and provides them with access to care. So you can go to our website, and it will link you to Childline, and you can directly also go to www.childlineTT.org or call 131 or 800-4321 to access the services provided by Childline. In addition to Childline, please remember that the Student Support Services Division of the Ministry of Education continues to provide support to children through their social workers and their guidance counselors and other members of their multidisciplinary team, so that right there in the school there is access to help if you need it. And those members of staff also collaborate with the external services, such as the child guidance clinics that the ministry provide through the regional health authorities. So help is available from a number of directions. In addition, most recently, the Office of the Prime Minister has also launched a resource for children. It's a mental health and wellness workbook. So children can actually work through their emotions in a child-friendly manner, where they have nice child-friendly graphics and things like that to work with, to help them to talk about their emotions and what they're experiencing and find solutions. So even though from what I've shared today, we're aware that challenges continue to abound, please remember that resources also abound, and now they are more easily accessible than they were in the past. So if you need help coping, please talk to someone or reach out to one of the services that I've spoken about. That's what I'm sharing today, and I hope you find it helpful. Thank you for your attention.
Thank you very much, Dr. Othello. And I just want to remind members of the public about the website. Of course, you can find it on the Ministry of Health's website, but you can go directly to findcarettt.com. That's FINDCARETT.com. And thank you very much, Dr. Othello, for that wonderful, for introducing that wonderful resource to us. And now we go back to Dr. Alexander for this very important topic: vaccine development and approval, safety and efficacy.
Dr. Othello, Ms. Alcantara, members of the media, and the general public. Today, I just want to talk about the vaccine development and approval with special emphasis on COVID-19 vaccines. Next slide, please. So, vaccines are needed to give immunity to the vaccinated individuals. Next slide. And there are different types of vaccines. If you wish to think about it, think of it as transportation. If you wish to get to San Fernando, you could either take a private car, you could hire a taxi, you could take the bus, you could take a maxi taxi. But these are different ways by which you get to San Fernando. Just as that, there are different types of vaccines to bring the specific antigen to the individual who will be immunized. And as you can see here, the different types that are encircled in purple are the ones that are currently in use by the COVID-19 vaccines that are either approved or in phase 3 clinical trials. Next slide. So there are various components in a vaccine. Most importantly, the main component is the antigen or the pathogen for which the vaccine is going to fight against. The other components that are in that vaccine are to ensure that a stable and usable vaccine is given to the general public. Next slide. So everyone is concerned about the safety of vaccines. When a person has been immunized, they are monitored for something that is called an AEFI, which stands for an adverse event following immunization. And this can range from an event due to the actual vaccine all the way to an event that is happening coincidentally at the same time when the person has been vaccinated. And it should be noted that any vaccine component may cause an AEFI. Next slide. So to ensure the safety of vaccines, many studies and tests are done. It starts at the preclinical stage, where the testing is done on cells and research animals. Only after approval is given, then it can proceed to phase 1, phase 2, and phase 3. And as you proceed to each phase, you will be increasing the number of individuals that are participating in the study, and you're also increasing the various groups, as in the different ages, the different health conditions, the different ethnicities. At the end of phase 3, the results are then given to a regulatory board, and it is at that point that approval is requested for general public usage. Only if that regulatory board gives that approval, it is then given to the general public. However, the studies do not end there. There is a phase 4 clinical trial where studies are continued, AEFIs are monitored, and it is just to ensure that the vaccine continues to remain safe for the general public. Next slide. So one comment that everyone keeps hearing is that the COVID-19 vaccines came about too quickly. Now remember that we are in the middle of a pandemic, and as such, different factors came into play to ensure that the vaccines were produced as quickly as possible. There were increased funding from all the governments of the world to ensure that the vaccines can be produced as quickly as possible. There was also worldwide cooperation and sharing of scientific knowledge amongst all the researchers. So anyone who wanted to work on the production of a vaccine was able to access this knowledge. And because we're in a pandemic, a lot of individuals volunteered to be part of these clinical trials. So there was high clinical trials enrollment. All of this contributed to the speed by which the vaccines were produced. Next slide. So thus far, with respect to the COVID-19 vaccines, there are the typical side effects that are seen within vaccination, and these can include pain, headache, muscle aches, but all individuals who experienced these did recover. With respect to specific AEFIs, there have been cases of anaphylaxis, but the percentages of those cases are very small, 0.001% and even less. And in those cases, the majority of those cases, the anaphylaxis was seen within the first 15 minutes of immunization. So it was caught because the individuals were being monitored, and all the individuals did recover. Next slide. So I've just gone through how vaccines are made to be safe. Let us look at how they are known to work. And this is where we talk about efficacy and effectiveness. Now, efficacy is the percentage reduction of a disease in a group of vaccinated persons in a clinical trial. So the persons in the clinical trial who've received the vaccine are compared to persons in the trial who have not received the vaccine. And the reduction of the disease is what gives us our efficacy numbers. Effectiveness, however, is measuring how well the vaccine works when given to the outside community, to the individuals in the general public who are not part of the clinical trial. Next slide. And last year, the FDA announced that a 50% efficacy was needed to control this pandemic for the COVID-19 vaccines. And so it is great news that the vaccines that have been given approval are way beyond that 50% efficacy required. If we are asking about effectiveness, you can look at Israel, who has a vaccination program whereby they are also collecting data. And what they have shown is that for the individuals who have received both doses of the vaccine, that the effectiveness is very high. So about 0.04% of those individuals who received both doses were reinfected. So that means it's 99.06% who received both doses and were not infected. Those are very good numbers. Next slide. So what is to occur next? Well, obviously, we need to continue a worldwide vaccination campaign. And this is especially true to minimize the emergence of variants for this virus. At this point in time, 11 vaccines have been approved for use in at least one country, with one more seeking approval by the end of February. And in development, there are at least more than 70 vaccines that are going for approval. So we have a wide variety of vaccines that will be coming up in the near future. Of course, monitoring and data collection will continue to occur, and studies are also being done where new protocols of vaccinations will be ongoing. I thank you for your attention.
Thank you very much, Dr. Alexander, for that very clear presentation. And I know you would have answered quite a bit of questions that are in the public domain. So thank you very much. We go now to the question and answer segment of this morning's media conference. Media representatives, I think you know, please pose your 2 brief questions. The panelists are ready to respond. If we have additional time, we will come back to you, please. We begin this morning with questions from Newsday.
Hi, good morning. This is Paula Linder from the Newsday. So my first question is to Minister Dialsingh. Previously, you've said that we're looking to vaccinate 20 to 33% of our population in the next year. But studies have said that 50 to 88% of the population should be vaccinated to get herd immunity. At what point does the Health Ministry plan to vaccinate enough people for herd immunity to be achieved? And also, will that 20 to 33% that we're looking at lead to that level of normalcy that you spoke of in your opening statement? Thank you.
Thank you very much, Paula. So yes, the COVAX facility, as we have said many times, has an initial strategic objective of vaccinating 20% of the global population to end the acute phase of the pandemic. So that is what we are working with and towards that goal. Herd immunity will obviously take a lot more time to move up to 50 or 70%. To give you an exact date at this point in time, my crystal ball doesn't take me so far into the future. What we are concentrating on now is getting enough doses of the vaccine to fulfill our COVAX obligation of vaccinating 20% to end this acute phase. Thank you very much.
Thank you very much, Minister. And we go now to Wired 868, please.
Hi, good morning. Fayola Bostic from Wired 868. I have a question for the Minister that is concerning sports. The current FIFA rules allow football clubs to block their players from traveling to any match which would involve a quarantine of 5 days or more. So we're wondering if the Ministry of Health will grant an exemption to the footballers traveling here for the Guyana versus Trinidad and Tobago World Cup qualifying match on the 25th of March, given that our quarantine period is 7 to 14 days. So that's my first question to the Minister.
Go ahead.
My second question is a follow-up with Dr. Alexander based on Newsday's question, which was, do we actually need herd immunity to end the pandemic? And if so, what happens if we don't achieve it either locally or globally?
Okay, so I'll take the first question on football. The Chief Medical Officer is in contact and in discussions with the football fraternity to deal with that issue. We are very concerned about people coming into the country and not quarantining properly and possibly bringing in the new variants, whether it's the South African variant, whether it's the UK variant, or other variants. So the decision will be made in the best interest of protecting the health and safety of our population.
Thank you. And we go to Dr. Alexander to respond to the second question, please. I just want to make sure that we have the volume up.
The pandemic.
Dr. Alexander, please start again so we can hear the entire response.
Sure, not a problem. If I am correct, you asked if we need herd immunity to end the pandemic. I just want clarification. When you say end the pandemic, what do you exactly mean? We definitely need vaccination to start the elimination of the virus in our community. But as Mr. Diyal Singh said, it will take some time to reach the stage of herd immunity. What I can say is that once we continue with the vaccination program, we can start to return to a sense of normalcy. But it will take time for us to reach a stage of everyone being vaccinated.
Thank you very much, Dr. Alexander. And we go to ACP News, please.
Hi, good morning. Priya Bihari, AZPnews.com. My first question, I think maybe for Dr. Alexander. Dr. Alexander, there seems to be some mistrust still with the COVID vaccine in the country. People say that they don't fully trust it. So what, therefore, can you do to convince them that it is safe and that it will be effective? My second question for Dr. Otello. Dr. Otello, we are in the carnival season and some people are complaining of, carnival tabanca. Even in the schools, we usually have the jump ups in the schools. And so what advice you will have for these people who, are missing their carnival?
Okay, let me just jump in on the first part of the question before we go to Dr. Alexander. we speak, and we should speak about vaccine hesitancy. But you know what? I am comforted by the literal hundreds of requests I am getting from individuals and organizations to be vaccinated. So it's two sides of the coin, but I think what is happening as we produce more and more evidence and we talk more and more and give the scientific evidence, a lot of the vaccine hesitancy that we spoke about a couple months ago is starting to melt away. I am absolutely pleased by the amount of people who are contacting me almost every single day to access the vaccination in their neighborhoods, in their businesses, and so on. So let's focus. Let's not give the opposite of what we are trying to do more focus than it deserves. Yes, we recognize it. Also, the University of the West Indies, under the Dean of the Faculty, Professor Terence Simangal, has offered the use of the Social Sciences Department to get into communities, to talk to people, so we could allay their fears. I mean, if you have a fear of something that is natural for you, we may feel it's unfounded, but to them, it's their reality. So we have to recognize it's their reality and give them the information. But I am pleased to say, as we give out more and more information, more and more people are reaching out to us, and organizations and businesses with 100 people, 200 people, chambers of commerce are reaching out to us to be vaccinated. Dr. Alexander.
Yes, we go to Dr. Alexander. Please to continue response.
Yes, thank you, Mr. Dial Singh. And I totally agree with what Mr. Dial Singh said. What I would encourage is for those who are hesitant to seek information and facts, scientific information. As the processes continue, we are gleaning more information from not only trials, but persons who have been vaccinated. And I think this will encourage others to get vaccinated. But more information is needed. So information needs to be spread throughout the community. And I know that the Ministry of Health is doing its part along with the University of the West Indies to do so.
Thank you very much. And we go now to Dr. Othello for the response to the second question. We just want wonderful.
Thank you for your question, Prior. It is a very relevant question at this particular time, and I'm glad you asked it. And essentially the answer is the same as we said coming up to Christmas time, where we were missing Christmas and we were wondering how we would get through it and so on. So that if Carnival is a big part of your annual experience and you look forward to it, I'm sure you're disappointed that we're not having Carnival this year. But again, there are things you can do, and I'm seeing some of it online even at the moment. You know, there are online concerts where nobody is physically in a concert arena, but calypsos are being played and people are listening, and, you know, we have to dance in our living rooms, you know, or in the front yard or the gallery or somewhere with your members or your family, with the same people who you live with, the same people you normally are in close contact with. In other words, stay within your circle. And by circle, you know what I mean by now, so that we stay safe. Again, the advice is stay safe this year so that you can have it next year. If you're not around next year, the fact that you had a great clandestine backyard activity praying that the police don't catch you, not going to count, because you're not going to be here next year. So let's really discourage the clandestine gatherings, and let us really stay safe.
Thank you, Dr. Othello. I love that. Stay safe this year so that you can enjoy it next year. We go to TV6 now for questions, please.
Hi, good morning. Vanessa Cutting, TV6 News. To the Minister, could you state what is the desired percentage of the population that would have to be vaccinated in order for us to move forward with the further lifting of restrictions? And could you also say whether the reopening of borders would be contingent on this, please? Thank you.
Okay, thank you, Vanessa, for the question. So there's no magic percentage that I can tell you that will lead to borders opening or roll back on restrictions. It's more than that. It will depend on, yes, the number of vaccines, 2, the number of cases, 3, the number of fatalities, 4, the robustness of the healthcare response. So it's all of those factors that we take into account before we decide on any measures to implement or measures to roll back. So there's no one magic number. It's a whole suite of information and data sets that we look at. We look at doubling time. Is it time for cases to move from 100 to 200, 10 days as opposed to 40 days? So I can't give you a figure for number of vaccines. So I hope that contextualizes the complexity of that decision-making process. Thank you very much.
Thank you, Minister. Now CNC3, please.
Hi, morning. This question is for the Minister.
Yes, we can hear you. Please proceed.
Hello?
Yes, we can hear you.
Minister, just wanted to find out real quickly, following the death of Andrea Barrett, we've seen widespread vigils and demonstrations taking place, large groups of people voicing their outrage. Is there any concern on your part that people may be flouting the public health regulations during these events and that it may lead to a super spreader?
Yes. So first of all, let me express my personal condolences to the Barrett family. I have a daughter. I wouldn't like to be in that position, so my deepest condolences to the father. You've put me in a very somber mood now. To answer your specific question, we are always concerned about any gathering. I recognize that the national community wants to grieve, and gathering with candlelight vigils is an accepted way of grieving, showing solidarity with the family and presenting your case to the public. What I will urge people to do, and the organizers of the vigils, is just organize your vigils in a way that you have 10 persons in any one vicinity. Just make sure they are masked, have hand sanitizers, make sure they are not talking to each other without masks, make sure they are distanced as far as possible. If you want to have a vigil with 30 people, have them in groups of 10, separated. Just stick to the public health guidelines, and we should be fine. But I wouldn't advise people, I wouldn't say as Minister of Health this morning not to have a vigil. This is a very deeply emotional issue, but like any gathering, there is the potential to turn it into a super spreader event. So there is always that potential when people gather, but for the vigils, gather, do it responsibly, comply with police directions, and we should be all right. But thank you for asking the question.
Thank you very much for that question. We go to Newsday for a follow-up question, please.
Good day again. The Prime Minister of Barbados spoke about sharing some of the vaccines that Barbados received from India with Trinidad and the other Caribbean islands. Could Minister Singh speak to that? And I just want to ask Dr. Othello, in light of Andrea Barrett's passing, what do you say to the parents of children who have to send their children to travel to school every day?
Okay.
Thank you.
Thank you, Paula, for that question. Yes. So the Barbados Prime Minister, the Honorable Mia Mottley, did indicate that they have received 100,000 doses of the AstraZeneca vaccine, which I think may be distributed to some territories. We are in a position to accept any vaccine that is certified and goes through the regulatory process by WHO. So once that criteria is met, we have absolutely no problem in taking part of that vaccination program. So once it meets regulatory muster, we are ready, willing, and able to cooperate with Barbados, and we look forward to receiving some. Thank you very much.
Thank you very much, Dr. Othello.
Okay, first of all,
just check your mic. Wonderful.
First of all, I would also like to extend my condolences to the Barrett family and to Andrea's friends, her peers, her work colleagues, and everyone else that's grieving at this time. It is a difficult experience to have to go through. In terms of advice, I have to say that we have to continue to be careful but not fearful. We cannot afford to live in fear. It's not good for our mental health. It's not good for our physical health. So we have to do the things that we need to do to keep ourselves safe. And by no means am I saying that she did not do what she should have done. I'm not saying that at all. But I'm saying let us do everything within our power to be safe, but let us not be fearful. Let us not be afraid to leave our houses, or afraid to go to school, or afraid to participate in activities that we normally have to participate in, because we cannot live that way. So let us continue to trust, those who have responsibility for protecting us, and, give them the opportunity to do their best, while we continue to do what we can to assist in keeping ourselves safe. But be careful, but not fearful.
Thank you very much, Dr. Othello. And I must apologize. We need to go to TTT for them to have 2 questions asked at this time, please. And we're going to TTT, I think. Okay, we seem to have a little challenge. So let's go now to Wired 868 for 1 follow-up question, please.
Hi, good morning again. This question is for the Minister. Minister, you just spoke about the numbers of people who have been calling you to sort of raise their hand to get vaccinated. So I'm wondering, obviously the ministry has its policy and its rollout priorities, right? So when the vaccine moves to private hospitals, etc., would there be any kind of price controls to maintain the equity in which people get access to the vaccines, or will it be free market?
Oh, you mean whether it will be free?
Pardon me?
Okay. So when the vaccines reach the private sector in the second part of the rollout, the first part is for healthcare workers, our persons in our non-communicable diseases clinics, our elderly, teachers, so on, essential workers. When we reach the private sector, it will be given to them free, and they have all agreed to give it out free. So there will be no charge for the COVID-19 vaccine once the vaccine is acquired by the government of the Republic of Trinidad and Tobago. So I hope that answers your question.
Thank you very much, Minister. And we go to TV6 for 1 follow-up question, please.
Hi. Now that COVID vaccine programs are rolling out across the globe, could you say whether government is actively considering perhaps requesting that persons entering the country now have a COVID vaccination, have had a vaccination, perhaps for some specific period of time before entering, as opposed to a negative PCR test?
Okay, thank you for the question. That is something that I think we will be considering, maybe with guidance from WHO. Our borders are still closed. That conversation will start, I believe, in earnest if and when, well, not if, I mean, the borders have to be reopened at some point in time. Whenever that is, that conversation will start then. But we are already preparing, just like we do for yellow fever. If someone wants to travel, they can get their international vaccination card to show that they have been vaccinated, so that any country that wants proof of that, you will have it. but it is something we are actively working on, but we don't have a concretized position on it yet. We will be considering that in tandem with WHO's requirements and so on. So thank you, Renessa.
Thank you very much, Minister. And we end with questions from TTT now, please.
Good morning. Terry Ann Brown Campbell from TTT. I have a question from a viewer who's in a quandary. Her 81-year-old father is in Florida with her, and he has been trying to get home, received the exemption, but he's already had his first dose of the Pfizer vaccine. Now, his second dose is on the 25th, and his exemption date to come home is on the 13th. She's asking if, what should she do? Allow him to come home because he really wants to come home, or allow him to wait and hopefully he'll get another exemption. She's hoping for some guidance.
Okay, so without speaking to the particular case, the general guidance at this point in time is that any patient who receives the first dose of any two-dose regime of vaccine should try to stick to the regime where they get the second dose from the same manufacturer. So whether you got your first dose from Moderna, AstraZeneca, or Pfizer, you should stick to the second dose from the same vaccine. There have been no clinical trials to date to show either safety or efficacy in mixing vaccines. There is one clinical trial being done now, mixing the Sputnik vaccine with the Oxford AstraZeneca vaccine. But as a general rule of thumb, a person who receives a vaccine from manufacturer A should get their second dose from manufacturer A and not mix vaccines. Thank you.
So thank you very much, Minister Dayal Singh, Dr. Othello, and Dr. Alexander. We have come to the end of today's media conference. Please remember that your mental health is just as important as your physical health. So seek support for any mental health issues that you may be facing. Use the resources that was mentioned today. findcareTT.com, and please share accurate information on COVID-19 and the COVID-19 vaccine with friends and family so that they can make an educated decision about their health. Have a good day, everyone. Stay at home if you don't need to go out. And please wear your mask.